really excited to bring together this panel of policymakers to talk about their experiences working with academics, researchers, and so forth. Because as we're talking about how we bridge that divide and do evidence-based policymaking, ultimately, the evidence has to get to these folks. And the panelists here are really the people who really do the work, right? So I could have asked some of my legislative colleagues and so forth, and I was in the legislature, but these are the folks who actually do the actual work. You know, we go around giving speeches and, you know, we have to run for election and stuff like that. But they're the ones who are presenting actually in some ways, we heard from Secretary Becerra, the options. Well, you might provide options. They also provide the analysis and the options to those of us who are in elected office. So I'm very excited about this group of panelists, and actually, they're in different roles, so to give different perspectives. And you can see their bios in the literature, so I'm not going to go through the whole bio. But you know, we have Pulmano, who actually is the advisor to the Speaker on health policy. Actually, I had a chance. You know, she worked. I had opportunity to work with her when I was chair of the Assembly Health Committee. Scott Ogus currently is, you know, he's the budget consultant for the Budgets Committee on Health and Human Services. So oftentimes, and used to work for finance, but has to look at things from a budget lens. Carolyn Chu actually works at the Legislative Analyst Office. So they're kind of this, kind of like Congressional Budget Office. Actually, the CBO is actually based on the California LAO, which provides sort of this, you know, provides us what we call neutral advice, I guess, to the legislature. And then Don Moulds, who's currently at CalPERS, but also has had different roles in the federal government and so forth. And of course, he actually sort of represents the executive branch of sorts. You know, he's actually implementing policy over at CalPERS, but also has had other roles as well. So I'm just so excited to bring this panel here. And so I'm going to ask each of you to spend their first 5 minutes sort of talking about like what you do, and then how you currently work or not with researchers and academic, what collaborations that might currently exist or not in your role. And finally, probably, I know it's all compressed in 5 minutes, a little bit about what you see are the opportunities for that. And then we have some questions, and then we want to open it up for all of you to ask questions as well to this amazing group of policymakers. So we'll start with you, Ros.
Thank you, Dr. Pan. Good morning, everybody. My name is Rosielyn or Ros Pulmano. It's great to be here in front of a lot of our researchers. I work for the Speaker. I handle all of his healthcare issues. That includes budget, all the bills, and appointments. For example, Covered California, Office of Healthcare Affordability, any appointments that the Speaker has in statute. It's a broad subject matter because, you know, if you think about Medi-Cal, if you think about health insurance, all things Knox-Keene, including a little bit about the PPOs and behavioral health, and there is a lot, and the budget associated with those two, including for the State Department. So it is a huge workload. And in that sense, I could say I have relied on a lot of research. In fact, I've worked with rock stars that's in our audience, Professor Kahach, Janet, Richard Kravis, the California Health Benefits Review Program. We work with them a lot. I've worked with them for about 20 years, looking at the mandate bills. So that is really the breadth of, I'm sure I'm forgetting something, but that's an example of how we're working with our researchers. What is the last question again, Dr. Pan? How do we like to, what are other things that we would like to work on?
Well, I would say is what are opportunities that you see for researchers to help inform policy from your seat?
So speaking at our informational hearings is helpful. Any research that you have that you think is helpful for the legislature to know about, think about, just feel free to email it to us, contact the chair of the health committee or even the Speaker's office, and of course, you know, the other house as well. I do make phone calls to specific researchers when the need arises. And oftentimes, that is because we hit a wall or something, or, you know, our bosses tell us, you need to do this or find something. And we like to have a list of people that we would like, or we could connect with, so that, it's handy. Because when our members say, we talk about timelines, right? Members are really demanding. And when they say, I need this, it means like in 24 hours or 48 hours if you're lucky. And so that's like sort of some of the examples that I hope we could, move forward with.
Hi there. Thank you, Dr. Pan. Thank you for having me. I'm really excited to be here and talk to you all today. My name is Scott Ogus. I'm the Deputy Staff Director for the Senate Committee on Budget and Fiscal Review. I primarily staff issues in our subcommittee number 3 on Health and Human Services on the health side, so Medi-Cal, our public health system, our health insurance system through Department of Managed Health Care, Cover California, small things like that, things that don't really matter to anybody, right? So I've been doing that since 2017. My role is to help the legislature evaluate the governor's budget when it comes out in January, and maybe incorporate a little bit more of the legislature's priorities into what ends up being the final budget at the end of the process in June. This governor has long been interested in the topic of healthcare, and so we spent a lot of time trying to move things in a better direction, at least from the legislature's perspective. And so we have to rely a lot on evidence that we get from folks like you and from folks all around California, all around the nation, about what the best direction is to go. Before I was with the committee, I worked for the Department of Finance, so I was on the other side. I was crafting the governor's budget. A lot of the evidence that flows through that process comes from departments trying to do their best. And and every governor is different. This governor tends to rely a lot on stories that he hears from people that he talks to, and kind of directs his folks to kind of solve problems that are salient, that he's heard a lot about. And we have to sort of contend with that, when the budget comes to the legislature. But before I was at Department of Finance, I worked for the legislature for a little bit. Before that, I was a molecular biologist right out of college. I was sitting at a lab bench trying to unlock the secrets of the universe, or at least the secrets of transgenic mouse models of obesity. I harken back to that time a little bit, when we're thinking about how to use data and evidence in the work that we do in the legislature. I remember I'd be sitting at the bench. I'd be doing a radioimmunoassay, or I'd be doing some kind of assay on our mouse models, and I'd crunch the numbers through our statistical software, and I'd get these really great graphs, really big separation, lots, really tight error bars, p-values with lots of zeros, and I'd be super excited because I knew that was a great result. And my principal investigator, Dr. Fareed Shahab over at UCSF, he would always come and say, "What's the story?" He'd say, "Well, okay, that's great, but like, what does it mean? What is the story?" And I never forgot that, and it reminded me, and it continues to remind me that you can have great results, but if you don't have a compelling story to tell, then your data isn't going to be useful to anybody. And so, that's kind of followed me throughout my career. There's data, and then there's a story, and sometimes the data is really compelling, and then sometimes it's just directional. It tells you kind of the direction to go. A couple of examples throughout my career, when I was first working for the legislature, I worked for Assemblymember Mike Fewer out of Los Angeles. And because I had a science background, he was like, "All right, I'm putting you in charge of environmental safety and toxics." And I'm like, "But I'm a biologist." And, "Well, okay, fine, sure." So we started working on this program, this topic area, green chemistry, and it became the Safer Consumer Products program at Department of Toxic Substances Control. But we had spent a lot of time in the legislature going through and running these bills that say, all right, we're going to ban this chemical, or we're going to require this restriction on chemicals. And we thought, all right, well, why don't we just give the job to the scientists at the departments? We thought it was a great idea. It didn't always work out the way that we expected. The political realities sometimes take over, and regulations don't get written in the way that you want them to. But the idea was we have this situation where we have lots of uncertainty about the impact of toxic chemicals in consumer products on people's health. Let's let the science drive the decision making. And there is a lot of decision making that happens under conditions of uncertainty in the legislature. Like Dr. Pan mentioned, there's legislators want to solve problems. They want to solve them now. They don't always have time to wait for the randomized controlled trial to come out to prove that there's a causal link between X and Y. They just need to do something. And so, the stories that we tell about the data that we have end up being important in how we drive decision making. The last thing I'll say, I'll say two more things. One, sometimes the data is really compelling and it just kind of plaintively wails for a solution. An example that was relatively recent was coverage of hearing aids for children. The data is pretty clear. Kids who don't have access to hearing aids end up with slower language acquisition and end up with lots of downstream problems throughout the rest of their lives, which the health system and our society pays for in myriads of different ways. Whereas the coverage paying for coverage for kids with hearing aids is a relatively small amount compared to the downstream impacts. But it took us, and it is still taking us, 8 years from when we initially had a bill to try and mandate coverage for health insurance to when we're finally going to get it as a mandated benefit in covered California and in the insurance market. So, the data was there, but now we've had 8 years waiting for the politics to catch up. And then finally, what I'll say is, we heard from Secretary Becerra today. There is a serious problem about using evidence base in the health space that is confronting us right now and is going to continue to confront us for the near future. A lot of the agencies that Secretary Becerra used to oversee have kind of vacated their responsibilities to provide trusted information to the public about decisions that we make at a policy level or at an individual level. And in the state of California, we're trying to work with scientists, we're trying to work with researchers to figure out the best way to recapitulate a lot of that information. And I think the work that you all do and the work that researchers here and elsewhere do, I think is going to be very important to that effort as well. So.
Good morning, Carolyn Chu from the Legislative Analyst's Office. As Dr. Pan already mentioned, our office is the nonpartisan fiscal and policy advisor to the legislature, akin to the CBO. So I'll talk about two major buckets of our work where research really can come into play. The first is in the budget. So we are, generally speaking, we are just a very fiscally minded office. So our role is akin to Scott's in that we react to what is put forward by the administration in terms of how the state should spend its money and try to give the legislature kind of the good, bad, and the ugly of what is put forward to them. And the legislature is largely in a responsive role, right? The governor gets to be the first mover on how to spend the money, and then the legislature is trying to kind of move things on the board relative to what is first put forward. Most often for our office, given our nonpartisan role, we are looked to very heavily when we have a budget problem, and no one really wants to listen to us when there's a surplus. So we get to be in the unfortunate position of trying to find the least bad option for legislators when faced with a budget problem. So as folks may be aware, the state has had a deficit the past couple of years. It's currently anticipated that the state will continue to have a deficit, though give a little plug to our office. Our outlook for what folks can expect going into next year will come out later in November. And in those cases, when we're responding to the deficit, we're looking to the research to try to understand, okay, how can the state pull back in ways that are potentially least harmful? And how do you measure least harmful? And who are the harms going to kind of be put against, or who are the benefits going to accrue to? We often are in a position where different groups, either through the budget process or our next bucket of work I'll talk about, come to us sort of saying, well, if the state does X, the benefits will be Y. And often those benefits are social benefits, but not always benefits, as in the hearing aid example that Scott gave, that accrue to the state. And so we often need assistance in trying to disentangle and distill, how can the state think about how to leverage those social benefits? What kind of social benefits are they? Will they yield greater economic output down the road, or how should we couch what those benefits can be for the state, particularly in the budget context when it comes down to it, that the state must have a balanced budget for the general fund at the end of the day. The Constitution requires it. The other bucket I'll talk briefly about is the initiative and ballot measure work. So, as was mentioned, there is an election coming up. Hopefully everyone got their voter information guide. We are tasked in that voter information guide in every voter information guide, not just in a special election, but with writing the nonpartisan description of the measure and its fiscal impacts. We don't write the title and we don't write the summary, that's the AG, but the description of what the measure does and what we expect the fiscal impacts to be. But that largely by statute is focused on costs and revenues to state and local governments. And so secondary and tertiary effects in terms of social benefits can be harder under our mandate for us to bring up unless there's very clear evidence as to what those will be. And so that's a big area where we look to researchers and look to the research to try to understand how can we try to best inform voters about how to think about those fiscal effects and what is known in terms of possible benefits, particularly when it comes to different types of medical interventions or different types of spending on health research or health interventions. And the health area, as I'm sure you all know, is a very active, particularly this year, area of initiative work and areas where a lot of different groups are interested in making policy through that pathway. We often at the LAO end up interfacing with sort of aggregate groups for policy interests. So we talk with CMA, or we work with the county behavioral health directors associations, or these different types of kind of aggregated entities of different players in the health space. And so for our purposes, what can be somewhat difficult in some cases is trying to get past that kind of first level of interface and to folks who have better granular knowledge of the issue that we're trying to analyze, often in a very short time period. Something that happens in some other areas of policy research for our office that would be, I think, very beneficial for our office as well as the policy committees is sort of small convenings on policy topics where non-experts can get, in half a day or a day, hey, here's the latest research about X. Here's what we know, here's what we don't know, in a group where they can feel comfortable, quite frankly, because a lot of folks are not trained scientists, asking questions that maybe in a big convening would be more difficult. So I'll end there and pass it over.
It is now. Great. Thank you. So hi, my name's Don Moulds. I'm the Chief Health Director at CalPERS. Some of you probably know CalPERS, maybe some of you don't. CalPERS runs the largest defined contribution pension system in the country. They do that on the south side of Q Street. On the north side of Q Street, we oversee the second largest health purchasing program in the country. So we're second to the federal government in size and number of people that we buy health insurance for. We do that. We spend about $12.5 billion on health insurance every year. And as I said, about 1.5 million people. So very large purchaser. I also, because I am getting old, have been in a lot of other roles that are sort of at the nexus between research and practice. So I ran the Senate Office of Research some time ago now in California. I was the head of the Policy and Planning Office at the U.S. Department of Health and Human Services in the Obama administration. I worked for Kathleen Sebelius. I was the executive vice president for programs at the Commonwealth Fund, which both does and funds research trying to better the U.S. healthcare system, and now obviously the role at CalPERS. So I'm going to talk a little bit about CalPERS, and then I'm going to throw 4 observations at you. So CalPERS is both a consumer of evidence and a generator of evidence. That's how I think about it. What does that mean? It means that everything we do ultimately is and needs to be based in evidence. So when we establish our drug formulary, for example, it needs to be based in evidence, because if it is not, we can do harm. When we are thinking about a new initiative, if we do not do a full lit review and somebody has tried it before to spectacular failure and we lose our shirt, that's a problem. So we use evidence that way. We often commission research. So for example, right now, we're secret shopping our behavioral health network working with the UC Davis researcher. We're doing work on behavioral health quality. We commission work like that. And then we publish research, and that's when I say we are a creator of evidence. So we try things that are cutting edge often, and we publish the results. We have a small but mighty research team at CalPERS. It's 6 people. Most of them are Ph.D.s now. They sometimes work with academics. They sometimes publish on their own, but for instance, I had the honor of going and testifying on some of CalPERS's innovative programs in the U.S. Senate last week, and most of the evidence that I was citing on the programs was coming out of JAMA or Health Affairs. So we take very seriously our role in the larger ecosystem and trying to better the U.S. healthcare system ourselves. So a couple of observations, and we can expand upon these in discussion. You have probably heard from everyone today, and you're probably talking a lot about the fact that academics and policymakers speak very different languages and some of the challenges that creates. But knowing your audience also is critical at a more micro level. So how the legislative branch uses evidence and how the executive branch uses evidence. Tremendously different. Happy to talk about it. How some legislators or some executive branches use evidence, very different. Second, and this came up in the last panel I was listening, I think it was your question, as a matter of fact, in the front row. But consider using, when you are working with policymakers, consider using someone or an entity that is in the business of translating research to policy. So Senate Office of Research did that. Most of the evidence that they used in their reports when we were doing work on paid family leave, for example, it wasn't our research. It was academic research that we are translating for policymakers. The LAO does quite a bit of that. It can be a very powerful tool for getting academic research into policymaking. Third, make a friend who is a policymaker or a policymaker adjacent. My favorite friends are committee staff. And then the last is do time on the inside. And what do I mean by that? Some of the most effective academics who really influence policy took time away from their career and actually worked in government or worked as policymakers. At ASPE in the federal government, we had a 2-year slot where we brought in a slot for academics who would come in for 2 years, take a leave, and work at ASPE. There are fellowships that do that, both at the federal level and some at the state level. Those are game changers for academics who want to make a difference.
Well, thank you all. Let me pose so I'm going to pose a few questions and then we'll open up for the audience. But I guess my first question is, each of you, I think many of you mentioned sometimes you'll reach out to a researcher, right? Because you're trying to find out something, and however you found their name. So they get the call. How should they respond? Should they oh yeah, I'll get back to them next week, or what should they do? So if any of them get the call, what would you tell them you should do when you call them? They should do when you call them.
please call me back. It happened to me. Like I said, I mentioned a few rock stars in our room, right? Where I reach out right away, they would send me an email, even at ungodly hours, and we really do work some ungodly hours, specific times of the year. And some folks could say, "Oh, this is so disrespectful of us." It's not our intent to be disrespectful, and let me just tell you a story of the context of my frustration at one time. We have what we call two-year bills, right? I don't know if you're familiar with those, but this is actually 25, 26, right? We have two-year bills. And the hearings for those two-year bills is, ungodly after the holidays in January. We have like 2 weeks, beginning of January, but that first week in January is really a lost week because our members are still trying to get back to school. So, but we staff have to prepare that analysis way in advance. I was doing single payer a few years ago, and I actually came upon this research that I wanted to talk about, but then I actually was sending an email at ungodly time, which is very close to the holidays. I did not get any response. And that was very frustrating. And I think I had to call on Chiburp at that point to just kind of, hey, what is out there? And I'm always grateful. Like I said, I work a lot with Chiburp, grateful for the work that they do. But I think, talk about like, and I think I'm totally unprepared for the introductions. I worked for Health Committee for 20 years. I was chief consultant for Health Committee for 10 years, and I did public health. Talk about vaccines, I did those. Talk about phthalates, I did those. Talk about ultra-processed foods. I had to handle that for the speaker this year. Talk about the Skittles bill, right? I did that analysis. And we had a lot of research on those. But if a member it's usually us lowly staffers that are calling or emailing, please just respond and say, "Oh, I'm sorry, this is not a good time." I did that. It happened again to me this year, beginning of this year, when I had some issue with wildfires. And I did not get any response. I think I emailed twice. And I also connected with UC Health. Didn't get a hit. And then the speaker was like, "We need wildfire bills." And again, these are the moments when village staff calls, and it's not your associate consultant staff calling. It's the speaker's staff calling. It's the committee chair staff calling. It means we mean business. We need something, and we want to talk to experts. It's a privilege when a lowly staffer like me actually wants to talk to people that know what they're talking about. So we would appreciate it, really, if we could get that call back, that email back. Oh, also, if you read a newspaper article and it talks about your research, please feel free to call that committee. Please feel free to call that author's office to say, "Hey, I wrote this research on this specific topic a few years ago, and I want you to see it." Usually the health bills that relates to public health or the big important bills usually are written up on the newspaper. So that's my opinion on that one.
So just remember, when you get that call, that's your chance to make the difference. And if you let it go by, don't complain. How come they didn't talk to you? Scott.
Yeah, I think this may be a counterintuitive answer from what you might think I might say, but I think probably first you should call your Legislative and Government Affairs person in your organization. And yes, I know I'm saying that, and maybe you think you won't be able to be as free, or maybe we think we won't be able to be as free with what you tell us if you've got your minders there. But at the end of the process, odds are we're probably going to need you either to provide some information, either publication or through publication, or testify in a committee hearing. And if your institution won't let you, then that doesn't really help us. So it's probably good to get just. I'm a stickler for process. In the legislature we go through a lot of process, but I think it's important to make sure that all those traps are run before you really start getting into it. But I think I think it's important then to have that kind of team effort to work together to help like we've heard throughout the course of today, translate your really compelling and interesting data into a story that we can tell for our members. Most of the members, with a few exceptions, are not really versed in how scientific inquiry goes. And they need to kind of understand, like, all right, well, what is, okay, there's this graph and it's got like bars and great p-values, but what does it mean? And so I think between the ledge staff, you and the Ledge and Government Affairs folks, you can help make that story real and really kind of make an impact in a way that kind of changes narrative, that kind of gets people understanding, like, all right, here is the reality, here's a real solid assessment of what is or is not a problem, and helps lead us to maybe not solutions, but at least in the right direction.
So some degree, I'd even turn the question back on you all. How can we demonstrate that we are someone you should want to respond to? We are try to be humble at the LAO. We call ourselves small but mighty. We're only about 45 people, analysts, that is. We have support staff as well. We are very small compared to basically every other institution in state government. And so I think for us, one question is, how do we kind of, at the headline title, subject of the email level, get your attention? Because everyone in this room is inundated with questions and folks who are looking for assistance in one way or another, and we're all trying to manage how to make the best impact with the time we have available to us. So any insights that you could share with me about that would be valuable. For responding to us at the LAO in particular, we understand if you can't meet with us or you can't meet with us on our timeline. Sometimes they are very tight. But if you can give us any crumbs to get started of where to go, we will value that very highly. Because even if we do get to talk to you, you're not the only person we're going to want to talk to. We want to be skeptical. We want to talk to many different people and get many different perspectives. And so if all you can give us is, here's a couple other names of people to talk to, or here's like for the first 5 journal articles I'd point you to, that is hugely valuable to us as a trusted researcher and knowledgeable person in the area to get us started down the right path, because the amount of information out there to sift through when we're often in the position of just reacting to something, we do write our own research reports, and I'll plug, we just did a big report on HR 1 when it comes to kind of state responses and issues. But that's really maybe only 20% of our time. We often are really just in reactive mode, trying to respond to the budget, initiatives, member inquiries, things like this. And so if you can just help us like open the right door, that's really valuable from our perspective.
I'm not sure I have a ton to add that hasn't been said. I'll just say point 1 that I made earlier, which is know your audience and understand their perspective. Your evidence can be used for many things. Some of it is the sort of intended use when you're generating it. Some of it is not, and you want to be aware of that.
So I guess the follow-up question is, okay, well, you didn't get the call. You're a researcher. You read in the news, or you, through whatever channels, find out, hey, there's a bill on the area that I'm an expert in, I'm doing research in. What should academics or researchers do and say, hey, maybe I have something I should share, but so what's the best way to relay that to each of you? I know you're busy, so you're not always taking phone calls yourself.
Well, at the LAO, our email addresses and phone numbers are all public, so you are welcome to reach out to us at any time, and we will definitely get back to you.
So we have two houses, right? Both Assembly and the Senate has to look at these bills. So if it's just on the first house, it's there is a lot of opportunity left to actually put your research across. You could be the expert, for example, for the hearing on that bill, especially if it's so controversial, and suddenly your research shed something very important for the author, very helpful for the author. So that's a good thing. It's in my mind, it's never too late, because We could submit it to appropriations when we're looking at the merits of the bill. We could submit it to the next House and then even to the governor's office. And so there's a lot of steps in the process that I think your research will continue to be useful for us.
But maybe more specifically, so if I'm like, hey, I'm doing research in this area, who should they reach out to or contact?
Well, like I said, committee staff and also leadership staff and also budget if it relates to budget, and all of our information are online. I think for the speaker's staff, it is not as transparent who's handling, but if you just call the main line, they'll be able to connect you with the right person.
Yeah, I mean, I think, in the budget committee, our information is right out there. You can contact us at any time. We'll route you to the right person. But, and I think this gets a little complicated for researchers, but a lot of times we will see research for the first time brought to us by advocacy organizations that have either seen your work or directly working with you and trying to kind of put that important information out there, which is another way of getting that kind of translational filter over the data to make it usable for policymakers. We worked a lot during a lot of these coverage expansions for both Cover California and also for the undocumented population in California. Work with the Berkeley Labor Center, who did a lot of really great simulations to help us understand what different policy changes would mean in terms of costs to the system. But we really had a lot of that mediated through a lot of the advocacy groups that were advocating for expanding coverage in those myriad ways. So it's good to have partnerships with advocacy organizations. I know there's conflicts that can arise with that, but also. Like we've all said, we're here, and if there's something really compelling and interesting that you need to tell us, we'll do our best to incorporate it.
Just piggybacking on some of the things I think Scott was touching on, it can be really hard to cold call someone in the legislature in the middle of session and start to introduce your work for the first time. This is where having cultivated relations ahead of time is enormously valuable. And to Scott's point, it doesn't have to be, best option is always going to be a well-placed staffer in my perspective, but there are advocacy organizations that have reputations in the legislature for taking evidence seriously and for honest brokering. Having relationships with them ahead of time so you can put in that call, they know your work, they know that it's going to be relevant, they're having those conversations every day. That can be a real difference maker, and so a little bit of work along those lines in advance can really pay dividends.
That's great. And I think sometimes there's like more official structures. Well, CHBRP's probably an example, which was actually established by the government itself or the legislature, and then we're talking perhaps more informally. Well, I do have other questions. I want to first give the audience an opportunity if you have some questions for the panel. Whoa. Oh, yes. There we go. In the back.
Hi, thank you so much for your time here. My question maybe was for Scott, maybe Carolyn as well. Scott, you alluded to this about the undocumented population. Before H.R. 1, because of the state budget cuts, already changes were being made to Medi-Cal, right? I wonder if, just to give us more context, more substantial, tangible of what, some tangibility of what we can do for those in the room, if we know actions like this are going to be taking place, or if we feel really strongly about something, can you give us an idea of what is some of the data that went into that decision, or some of the data you guys provided to either against or for that decision, and how that kind of process went about? So that way maybe it'll give us an idea, a more tangible idea of how we can be effective for things that we really feel strongly about.
Well, let me start by just saying last year's budget was really tough on a lot of us, And I think in this instance, the use of data for deciding what changes to make to our undocumented expansion population was essentially to try and figure out the ways to mitigate harm as best we could. We started with a budget that was "quote unquote" roughly balanced. We had it back in January, and we had some higher revenues than we expected, but we also had some higher costs in the Medi-Cal program from a variety of different sources. The administration started off with a very heavy push to try and say that most of the deficit later, or most of the increase in costs in Medi-Cal, were due to increased costs in the undocumented population. There were other expansions that we did in the senior population that were driving costs too, and some pharmaceutical stuff that was causing problems. But there was a very large push to kind of say this is because of this population. And then later, when we had the May revision to the governor's budget come out, and we had changing forecasts due to some of the federal economic changes that were happening, tariffs and whatnot, we were confronting a deficit. And so because this narrative had been already out there that it's this expansion population that's causing the costs in the program, that was where most of the attention was in terms of where to make cuts. So, we spent a lot of time trying to figure out, all right, what is the impact of making, of imposing a freeze on enrollment of this population? What is the impact of premiums? What is the impact of co-pays? And at the end of the day, you can say that, oh, these are just like program reforms, these are utilization controls, but when you're talking about budgets, which is what I work on every day, what the savings ends up coming from is from coverage losses. And so, I think what we tried to accomplish with the data was to map out, all right, what is the least harmful thing that we could do, and what is the thing that we could do that we could undo quickly if we found the resources to do so. And I think a lot of the data that we received from folks who study this, who do the simulation models, I think was really informative in helping us try to mitigate those harms.
I would just add on, maybe separately from last year's budget, but going into this next budget, I think it's very likely for anyone following the state budget situation that we're going to have some improvement in state revenues. How sustainable those are because of what they're based on, which is largely run-ups related to artificial intelligence and some major companies obviously being headquartered in California and resulting in very, very strong revenues. How sustainable those are and what that means for the long-term health of the state budget is going to be a core question. And it's going to be in the context of a general kind of withdrawing of federal activities. And so the state is going to face a lot of different questions about how to best respond, and this was alluded to in other panels and in some earlier comments on our panel. How can the state best move into some of those spaces, and what are the structures to do so effectively? And more specifically, maybe to your question, the state is in this budget cycle, the legislature is going to have to grapple with how to implement many of the provisions of H.R. 1 and how to do so in a way that aims to mitigate coverage loss, because coverage has been a major emphasis of the legislature over the last decade plus. And how can the legislature think about the requirements of that federal legislation in that context? What are its flexibilities? What does the research say about what kinds of flexibilities yield the best results to keep people covered? How can we think creatively about responding to increases in uncompensated care? What are the different levers? A lot of imagination is probably going to need to be used, and thinking a bit outside the box in this process. But sort of the questions that were grappled with last year aren't over. They're really only going to keep coming in larger contexts, because Medi-Cal is the second largest general fund item in the budget, but it is by far the largest state budget expenditure, right? The program is now up to almost $200 billion. That's almost equivalent to the full state general fund when you count all the different funding sources that come into it between the general fund, federal funds, local county funds, provider taxes and so forth. It's a huge program. And as Scott mentioned, the administration in its response to the budget problem that emerged really focused on Medi-Cal as the largest program and one of the fastest growing. And I expect that emphasis may not change going into this next cycle if there's still a budget problem. Sorry, one last plug I'll give is that the vast majority of the budget action ends up happening between May and June 15th. It is like in theory, the governor proposes a budget in January and there's deliberation over the proposals and careful consideration and so forth. And then in May, it's supposed to be like changes on the margin. That is not what happens. It is like a full redo. And then we do the whole thing in like a major sprint. And so, if you think an issue that you're working on that's important is gonna come up, get to folks in that first period, that January through April period, get in front of them so that they know to call on you in May, because that's when they're gonna be really crunched for time.
Yeah, okay, great. We have a couple of other questions. I just make a quick comment that certainly the data will help inform the policy, but in the end, and that's why I think Secretary Becerra said talked about options, right? In the end, people are going to have to make, unfortunately, they're going to have to make value judgments, right? And unfortunately, for example, the federal cuts, there's no way the state is going to, we can mitigate them, we can't reverse them. Right. That was and I think that's the policy challenge, right? So, but we would certainly want to make decisions based on data. All right, I see two. Okay, next question. All right, all right. Okay, and then okay, yes.
Hi. So we've gotten the call a couple of times, and one of the challenges that happens is that often the policymaker we're talking to is focused on the future. And the research that we've done is focused on the past. And they're challenging us to think about what about our research can apply to a new situation and a new set of facts. And for people in academia, which technically I'm not, but that's a challenge because they're so used to thinking in a different way, where they have to be very careful about getting over their skis and estimating something that they they don't have data for. So I'm wondering if you could talk about people who've done that well when you give them the call, and what that looks like, just for the folks from academia in the room.
I'll take a step. It's a great question, and it is just an absolute classic when you think about the different perspectives. And I will say that is not universally true when you think. You're going to get that call from a legislator. You could get it from another elected official in the executive branch. You're not going to get that call from OMB, right? Because their standard for evidence is going to be highest among the high. And so it is, but it is a challenge. The folks that I've seen who have been successful at doing this, one, get out of their comfort zone a little bit, but don't take too many liberties, because obviously if you're too speculative, that is problematic because it ceases to be evidence-based. But academics tend to be cautious about doing that because it is a different kind of assertion. There are academics out there who are very happy to make those assertions, and those are the ones who make traction. So no magic answer here, but a little bravery probably goes a long way.
I think, one of the reasons that, one of the values of basic research is just that you are studying things that you don't know what their value is going into the future. I think going back to the undocumented expansion, I think, when we were trying to figure out, all right, what is driving the cost here in this population? Because, it doesn't seem like it should be overly costly. We thought, all right, what are the most recent healthcare expansions we've had in California? And the most recent big example was the Affordable Care Act expansion. And what we started to notice was we had a similar trajectory. When you start covering a population that is that has not historically had coverage, there's a lot of pent-up demand. There's a lot of initial utilization. There's a big spike in utilization. And I remember when I was at Department of Finance when we were going through that, and we were having some of these similar discussions about, it's really expensive. Maybe we should pull back. Maybe we shouldn't spend all this money on this population. But eventually, once everybody found a regular level of care, it all kind of normalized and back to normal. And we're seeing a little bit of that story play out with this undocumented population as well. We're seeing rates coming in a little bit lower, a little bit more preventive service, a little bit less emergency utilization. And so we have that historical data of the study that was already done on a previous coverage expansion to kind of inform what we do. So, a lot of times you're looking backwards, but in a way you're using that backward-looking story to inform what you do in the future.
Just one other thought on, because I love the question. Remember in that scenario where you're getting that call, that if you don't put your perspective forward, somebody else is going to do it. So maybe that might help just on the bravery front, but somebody is going to make the extrapolation. Much better to have it come from somebody who's been studying an area for their career than somebody who has been there for 5 minutes or has an agenda.
All right, and maybe okay.
I can try. We've been talking about options as well, right? So I think maybe somewhere in that bridge, if an option A, B, or C could be provided, and there is still evidence-based research or backing for that, I think that would be helpful for policy staffers as well, because when they're calling you, obviously they're still at the research stage.
Yeah, I think that also I'd make note that when we were implementing the ACA, maybe that was, I saw my academic hat on. I actually told my colleagues, guess what? In the first few years, we're going to see a spike and it's going to come down. So we got to ride that out. Don't panic. But I think that's in terms of the role a researcher could play. I mean, again, trying not to get over your skis, but also maybe saying, well, this is the data I have, and this is the guardrails, but then this is how it might apply to the future. That's the bravery part. But so that might be a way. Last question, Dr. Blouse.
Thank you, Cal. Let's grab this one. Yeah, I think that segue is nice. That was sort of my question, but I'll change mine a little bit to say, can we think proactively about you all partnering, like giving us proactive questions? So HR1 might be a great example of, what we'd love you to keep data on or to track, or how do you to be ahead of this for us? Have you ever had those kinds of conversations? The research, like we all have a small staff, but it would be great if somebody else would be gathering data on this for next year for the budget cycle. And I was just curious if that was something that comes up, and that's another way to think about how we could partner together.
It's almost a what should we be studying question that would be useful to you.
I'll offer that I think that's a great question, because the state very often is in the position of wishing it collected better data about a program that it implemented or work that it's doing. I think another area that I cover or work with folks in my office to cover is homelessness, and that's an area where we are really bereft of very good data, and it's very challenging for the legislature to decide how best to spend its funds in that regard, aside from build more, period. So I do think thinking proactively about the implementation of HR1 and how the state goes forward in doing that, and thinking about what are the key questions we would want to understand, like how do people end up falling off of coverage? Better understanding, are they falling off of coverage because of the administrative requirements or because of the community engagement requirements, right? This is a big thing we grappled with in looking at this issue, is how the data on folks enrolled in Medi-Cal and their work and education and community engagement sort of existing activities versus what the enrollment data would tell us are very disparate. They're very different. And so I don't have any good immediate suggestions, but aside from all of it, it's a huge policy change and we'll really want to understand what the implications are moving forward, because we should know. We should know what ends up happening. So
We're coming close to the end of time, so I'm going to ask people to be really brief now. Sorry.
I can be fast, and I have a laundry list already in my mind. Prescription drugs, PBM bill, right? Implementation, is it going to lower prices? the insulin one, ColorX, $11. Is it lowering prices? How are we utilizing those, right? There's a lot on prescription drugs because it is something that the state cannot control. Affordability also touches on that. We have what we call the health payments database under HGI. There's a lot of information there, but again, staffers are not smart enough to figure things out. If anybody, if it's your issue area, please let us know if there's something in there that you could glean that is important to us. Rural hospitals, HR1 includes 50 billion rural health transformation, but at the same time, they're cutting funding for rural hospitals. And also, a lot of these hospitals are becoming distressed. What is going on? What can we provide? What are the solutions? It's like there's like a black box with these hospitals in our rural systems, right? The disparity in pricing in North versus South. We've always talked about market consolidation, but what is still happening, right? How can we continue to, have all these things in the system, and yet nobody's talking about it? We always talk about affordability, right, in healthcare. But what are those steps that leads us to affordability? That's it.
I love telling researchers what they should go do. So if you ever want to know, you can talk to me. And I've actually had a lot of these conversations relatively recently, but also throughout throughout my time in the legislature. There's folks, like I had a conversation with health workforce folks at UCSF, and I was like, wouldn't it be great if we had an atlas to determine where all the providers in the healthcare workforce are located, and what people's actual experience of access to care is, driven by demographics, cultural competency, language barriers, and whatnot. We've tasked, I mentioned the Berkeley Labor Center, when we're trying to evaluate coverage expansions, we've tasked them with trying to do simulations for us. There's other people in this room who I've hit up multiple times about as somebody who used to do research, it's like now I don't do that anymore. So it's something that I think a lot about wouldn't it be great if we had this information, or if somebody would study that, or we also had a big physician and dentist loan repayment program funded by Prop 56, where we wiped out debt for folks who participated in the program and agreed to serve in low-income and Medi-Cal heavy areas. And I thought that's a perfect dissertation for somebody to just do a study to track the folks who have their debt wiped out, to see if they stay in more public service-oriented placements, rather than having to go do something more lucrative because they have a house worth of student debt to pay off. So yeah, just call us. We will set you. We will give you lots of great ideas for what you should study, and you don't have to take them all, but at least you'll know what we're in need of. So.
Can I just? Oh, sorry. Behavioral health. Don, you're going to say it, right?
I was going to say that every challenge in the U.S. healthcare system is a pain point at CalPERS, so I'm not going to give you the list because you all know the list. I will say this. So as I mentioned, we partner with academics very frequently. We have what I regard as the best data resource in the country because it is so longitudinal. So we have very sticky membership, which means that you have a lot of people who are born in CalPERS and they have retiree coverage, ergo die in CalPERS and have data for that whole period of time. We are very, very strict about who we work with because of the data security issues, and we do not partner on things that aren't going to make our program better, but where there is a sweet spot there, we always are happy to have the conversation. David Cowling is the person who oversees the research team at CalPERS, and it is always worth a conversation with him about what we're thinking about, because we're always thinking about something.
Well, I think we're at the end of our time, and you very kindly did not put the stop sign yet. So thank you all for coming here to UC Davis and to Aggie Square and to sharing with us. And again, please feel free to stay if you're able to, but thank you so very much. Really appreciate it. Thank you.